Good afternoon and welcome. I was about to say good morning because I've been teaching on here all day and I keep saying good morning. But good afternoon and welcome. We are so excited to have you here for our first 2026 Educator Exchange. If you will please, in the chat, get us started with saying where you are from and anybody in particular, if it is your very first webinar, please share that as well. Let's see, the Gulf Coast of Mississippi. Is it cooler there than it is here? That would be, or warmer there than it is here? That would be the question. I'm in North Carolina. And it is not. Oh, welcome, Ashley. We're so excited to have you here for your very first webinar. Um, we do offer CEUs with these webinars, so it's a nice, easy way and hopefully informative way for teachers to get a little bit of CEUs early and accessible. The burbs of Atlanta, New Jersey, Memphis. That would be another time zone. Northern California. Oh my goodness. We see a lot of East Coast time zones at this time of day. So that's exciting to see. Not East Coast, not Eastern time. Welcome, welcome. We're so excited to have you all here. First time in from Texas, Sabrina, welcome. Oh, Kim, we got a number of first timers. This is amazing. Chris, or not Sarah. Yes, Chris. There's Sarah on in the blue, and then there's Chris down in your note. So welcome. Oh, Joyce from Texas, welcome. Oh my gosh, there's so many new ones. So many people coming in for the first time. Welcome. We are so very excited to have you here. Um, I know I apologize if you said you're a first timer and I missed you, but we are very excited to have you here. So I know looking through those, I'll probably miss some, but we're very excited and we can't wait to share about medical assisting with you. We want to ask a couple questions to get us thinking today. First, I want to ask you to put in the chat, is your favorite soda Starbucks? What am I saying? It's not Starbucks. Coke, Pepsi. I know in North Carolina we have a special drink called cheer wine, which is not wine. It's a soda. It's a cherry flavored soda. So if you have a favorite soda, please put that in the chat. Yeah, all my students like Dr. Pepper too. Oh no. And it's Chris. Chris, I wish I didn't like soda. I really need to stop drinking soda. Mountain Dew is my favorite, and I really got to stop drinking that because it's so not good for me. Um, Verner's. I'm not familiar with that one, Jennifer. Let's see. That's okay, Martha. What about coffee? Do you have a favorite brand of coffee since you don't drink sodas? Or are you a very healthy person who just drinks water? I'm trying, I just can't do it yet. Is anybody expecting snow this week? I did see some northern members coming to see us. Black coffee, no cream or sugar. Oh, Christine, you're way better than me. I have a little coffee with my creamer. It's snowing right. Oh, I'm so jealous. It's snowing right now where Jennifer's at. I have. I'm so jealous. Starbucks. So Elena, I'd be interested in what you get from Starbucks since you don't drink coffee. So I did want to remind you before I turn it over to Miss Nancy that we have an annual conference in October. This year it's going to be in Birmingham, Alabama. And as a health science teacher for it has now been 10 years. When in my second year teaching, I got invited to the National Consortium's fall national conference, and it was by far the best conference. As an athletic trainer, I'd been to 15 years of conferences before that. And the information I got at our national conference, where I was able to come home to my classroom the Monday after I arrived home and have activities that I could put right to work in my classroom, it was amazing. I just saw Angel Clark come in, and between Angel Clark and Sandy Pennicamp at my school, they really supported me in being able to go to that very first conference, and it has been life-changing in my health science career. So if you get the chance to come to our October conference, please make every effort to be there. On our website, we do have justification letters that you can share with your admin to help them be very supportive of you attending the conference. So the pre-conference, and I will apologize, I haven't looked at our pre-conference presenters, but the pre-conference is October 19th. I will get that information to you before we leave today. And then the conference itself is October 20th through 22nd in Birmingham, Alabama. So that's exciting. We will also have a link for the interest list placed in the chat before you leave today. So while not confirming and committing yourself to the conference, it puts you on the list so that we can let you know more information about the conference. And registration is going to open early next month. So just kind of keep that on your radar and be on the lookout. Now, it is my pleasure to be able to introduce to you our Executive Director, Miss Nancy Allen.
Thank you. Melissa, I don't think you told them about your leadership role. Did you indicate?
I don't even know. And my name is Melissa Sparks. I'm from North Carolina, and I am the Health Science Educators Association president.
Right. So Melissa is in a big role, and she got so carried away finding out where you were from and such, she forgot to tell you about her importance. So thank you, Melissa. Thank you all for being here. She did mention CEUs, and I didn't want you to get too excited about it. It's not actually a CEU. It's 1 hour of professional development that you will automatically receive a certificate of participation for being here live today, and you don't have to request that. That will come to you to your email address. So it's 1 hour of professional development, and hopefully that'll be helpful to you in some way that maybe you have to prove that for your teaching certificate or for your professional development opportunity. So there you go. We are very fortunate today to have Sarah Marino with us. She serves as the Executive Director for the Medical Assisting Executive. Help me, Sarah. I want to make
No
sure.
problem. Medical Assisting Education Review Board.
Education Review Board. And we actually met Sarah last year. She came to our annual meeting in Savannah. She was introduced to us by one of our strong members in the professional associations category, the American Medical Technologist. And they wanted us to know Sarah because Sarah has a lot of free resources. And if you have a medical assisting program at your school, or you're considering implementing that at your school or in your state, then free would be your favorite word. Now, Sarah works most often at the post-secondary level, but she knows that what she has to offer is something that you could always strive to attain if you're at the secondary level. And we may have some post-secondary educators on this webinar as well. What she has in the reviews that she does, she was very honest with us to say that some of the benchmarks that she reviews may not be attainable at the secondary level simply because of time, perhaps because of funding, but there are certain standards here that she reviews that she thinks you should all be looking to achieve. Have I said that correctly, Sarah?
There are certainly things we want to share, and there are, so many different pathways within medical assisting. So being able to explore those different pathways, and that is my central goal here because it varies so much what you do within the medical assisting education programs based on where you are, the scope of practice within the state. So that makes a big difference for accredited programs as well as all programs. We need to please everybody. So that's what our resources try to do. We fail, but we always give it the best faith attempt, and we're always trying to improve.
Right. And so, Sarah, we're going to hand you the microphone. We appreciate your willingness to be here. And also, Sarah was at our National Health Science Conference in Cincinnati. Some of you may have heard her there, and maybe she'll join us in Birmingham in October. And share more information. So, Sarah, thank you so much. And you can put your questions in the chat, and she doesn't mind taking those along the way. And we'll be helpful in helping her to see those and answer. And she will probably allow you to unmute at the end if you have some questions that maybe you didn't get to answer. So, take it away, Sarah.
Wonderful. Well, it's great to be here. I really appreciate the opportunity. And my goal is to share with you some of the resources that we have available. As Nancy emphasized, those are free resources. Nancy did a great job of introducing me, but let me just share my contact information as well. And I'll also show you where that information is available on the Mayor website. And the Medical Assisting Education Review Board, the catchy acronym we use is MAYERB, which, by the way, trips off nobody's tongue, but we use it and we kind of stick with it. And I will be sharing the information on the website. Just a little bit about myself. I've been in this position for 11 years now. It's been a true privilege to serve the community of medical assisting educators. They have taught me so much about what they do. I've been in accreditation for about 20 years. So the accreditation is really my first language. And I've worked with institutional accreditation and programmatic accreditation in other positions. So right now with the Medical Assisting Education Review Board, just to give you the big picture view, we are what is called the Committee on Accreditation under the Commission on Accreditation of Allied Health Education Programs. We're an independent organization, so independently incorporated, and we work specifically with medical assisting education programs under CAHEP, which deals with about 33 allied health professions. So we offer CAHEP accreditation primarily to post-secondary institutions. We've got a few hospital-based programs. The nature of accreditation is that we're dealing with national standards and curriculum. So while you were introducing yourself, I was looking at all the states and the cities thinking, oh, we've got a program there. We've got a program there. So we have about 330 programs across the country. And as I said to Nancy a few minutes ago, the nature of medical assisting with the scope of practice, it can vary from state to state. That is just the nature of the state laws. So we always try to serve everybody and make sure that we provide as broad a picture as possible. At the same time, the other thing that's so very important about accreditation is the communities of interest we serve. So we've got sponsoring organizations that work with the profession of medical assisting, and they're the ones who are teaching us what people are doing out on the job. And we translate that into our curriculum and work with the educational programs because a really important thing is that people who graduate from a medical assisting program that they are qualified to get a job and they are eager to do so and walk into their first position competent in the skills that they have learned. So, with that, my big goal here is to share with you the resources that Mayor has available. Part of the reason why I wanted to conduct this particular session, Nancy had told me about the nature of these sessions, is because I get a lot of phone calls from high school teachers, and they tell me, oh, I know we're not eligible for accreditation, but can I use the stuff on your website? And I say, go for it. Yes. Use it, adapt it, tell me what you've done. Because I have a firm belief that accreditation is a public status. I mean, it's not just a belief, it is a fact. Programs that are accredited have to state it publicly. But I also think we're a public resource. Our goal is to help all programs achieve the goals that they want to achieve. So we like to share these resources. They are available. I'm going to be focusing on some specific resources And I really tried to think about the ones that you would find most useful because I know you all have a great deal of experience in your areas. And it really is a question of supplement. What can you do to expand? Just as a point of fact, I started off my career as a teacher, and I learned very quickly that how to be a good teacher, steal shamelessly from good teachers, right? You know, and again, I did it all the time. I still teach part-time and I'm still doing it. That's the same is true with accreditation as we try to think about how to make our resources better and better. And we steal shamelessly from other accreditation organizations, and we also rely on our communities of interest. What I'm showing you here is the mayor website, and I'm right at the home page, and I'm just going to give you a brief overview of the website. You'll notice that it's not very fancy. We just have basic pages that you can click your way through. Here's our home page. When I say that it's very easy to get in touch with me, you just go to the board and staff, and you'll find me listed right here, and it's easy to drop me an email and ask me a question because again, I do learn from you, and it's something that I bring to the board because there is such a strong connection between the medical assisting programs at secondary institutions and those at post-secondary institutions. The other thing here, just because Nancy mentioned AMT, we talk about communities of interest when we're talking about educational programs, but MAERP has communities of interest, as I mentioned, with these professional organizations. Now, with all of that, I'm going to get to the points that you can find most useful. And we've got this one tab called resources. And I'm going to start with the biggest and the most important, and that's the resources for the standards and policies. And this is where you can find information about the national standards that accredited programs need to follow. We've got our standards and guidelines here. I'm not going to go into that in any detail. I think what's far more important and what I think you'll find more interesting is within those standards and guidelines, we have a core curriculum. And all accredited programs need to teach the entire MAERB core curriculum. So I can click on this, and if I go all the way down to the bottom, you'll see the MAERB core curriculum in,
Sarah, we're not seeing your screen. Oh,
oh
did you?
no,
Yeah.
you're not seeing it?
Are y'all seeing Sarah's screen?
I was seeing her
Okay.
tweet. Yeah.
Okay. My bad.
No problem. I'm sharing
So,
again. I just stopped for a minute.
okay.
Am I all
Yeah.
set there?
Yep.
Yes, I can see your PDF
Perfect.
standards.
Okay, wonderful. So we've got the Mayor Core curriculum there, but we've got something even better for you if you really want to take a look at this curriculum and you want to play with it and see what you might be able to use out of it. Is here we have the Mayor Core curriculum in a Word document. So I'll bring that up for you. And part of the reason why that is so much fun is that people do get to play with it and look at it and cut and paste. So my program director said to me, "We do not like PDFs, Sarah. We really like Word documents. I have to publish a PDF because that's a requirement. I need something stable, but I can also share with them a Word document." So here's the Mayor Core curriculum. We divide it into 12 content areas. I'm not going to go through this in every detail of each of the content areas, but I wanted to provide you with an overview of how we organize it because it's a useful way of thinking about the medical assisting curriculum. So essentially, you can see here we work with these two columns. And with these, we've got the cognitive. So as we term it, the cognitive objectives, what the students need to know. And then we've got the psychomotor skills that are essentially attached to those cognitive objectives. They know this certain material, and now you're going to teach them how to do different skills that are associated with that didactic area. So we do divide it into areas and we do think about it. So here we've got the anatomy, physiology, and pharmacology, and we think about it and divide it up with what they need to know, what they need to do. And we've got, as I said, 12 areas, and we follow this pattern very consistently. So you've got the applied mathematics, which I bet is your students' favorite part when they're thinking about how they need to calculate medication dosages. This is what I hear students complain about the most when I get a chance to talk with students. But at the same time, that's just not something they're learning on paper. They also get to apply it with the psychomotor skills. So it's something that they'll be able to use. So this is the pattern. It's a useful document. Our program directors, as I said, need to comply with this. I'm always amazed at the inventive ways that they play with the Mayor core curriculum, and they find it useful to divide it up into the cognitive and psychomotor because that way they can think about different ways to organize it. As I said, we've got these 12 content areas, but it's not like they teach the 12 content areas in order. They're constantly combining and recombining and thinking about how things relate because many of these topics relate to so many of the other topics. And it's really a question of how to help the students build. So the program directors have the freedom to do that. I thought you'd find this fun to see, mainly because it's a fun way to look at your textbooks as well. Many of the textbooks do tend to use our Mayor core curriculum, as well as the other medical assisting medical assisting accreditation organization, ABHES. So we often appear in the textbooks. I've covered the cognitive and the psychomotor, but there's certainly another area, and I know you spend a lot of time teaching in this area, and that's the professional skills, isn't it? The affective skills, the behaviors that they need to bring into the workplace as they're working with providers and with patients. So here, all the way at the bottom, we've got a list of affective skills. And with these specific skills, again, this is something that the program directors of the KHEP accredited programs need to teach. And what they often do is they take these specific behaviors and they embed them into the psychomotor competencies. Because as you all know, whenever a medical assisting professional has contact, be it verbal or physical, with a patient, those affective skills come into play. You've certainly been teaching your students you don't just grab somebody's arm for blood pressure. There's a way to approach it professionally and thoughtfully and caringly. So the Mayor core curriculum is really kind of the base of pretty much all of the resources that we publish. We're always trying to think about different ways to help program directors enter into the Mayor core curriculum because even though they need to accomplish all of this material, there are about 800 different paths for them to be able to do so. So we want to give them a hand, and one way that we do it is we've got a document that we call the Educational Competencies for Medical Assistants, and I'll bring that up. And that's something that's also available on the website, and I'll show you where. But basically, this is a little booklet that goes through all of the psychomotor competencies and give people options for how to teach those competencies. So we organize it just by the name of the competency. And if we're thinking about one that is very straightforward, documenting on a growth chart, here are some of the options, which really are very straightforward. But then you have something like with 2P1, and calculating those proper dosages of medication, then you've got a lot of different ways that you can put that into play. So these are just some of the options that we provide, and they are truly optional. for the program directors. And what's really fun is when we all get together at meetings and we start to talk about different ways to teach the psychomotor competencies, and they tell me very politely that the ECMA is very good, but they've got better ways to do it. And I nod at them cheerfully and say, send it to me. I'll include it in here. So we've got a lot of input from the medical assisting program directors that is very helpful and useful. So this is just one of the resources that helps them with the teaching and the learning. And this is a document that is always in process. I am not even going to confess to you how many times I have updated it because it's eternally being updated. There was one other area, though, I did want to show you. I had mentioned the affective behaviors as part of the Mayor core curriculum. And most of my program directors tell me, and this is something that you might echo, is it's really hard to teach behavior. People come into your classroom and they've got certain ways they interact with people and they think they're doing just fine. And you're holding your heart thinking, oh, but if you've got a patient in that chair, I want you to think about a different way. And at the same time, we also know that you can teach behaviors. And I think anyone out there who has raised a child would agree with that. You're constantly teaching your children how to behave, and how to care about other people. What we've got here with the affective skills, and this is something that people find very useful, is we've got different exercises for teaching affective. And we, again, as I said, we show people how to bundle them with the psychomotor competencies. But what the program directors really like are the affective rubrics, because it's so hard to talk to people about behavior. It sounds like it's subjective. How do you demonstrate empathy? Well, there are certain clues that we look for when we think about empathy. There are certain ways that we measure critical thinking. Um, and the rubrics are very helpful for giving students that vocabulary of thinking when you give them a list of something and say, this is how people evaluate this behavior. So the rubrics are one of the things that my board is the most proud of, because they're able to be much more specific, and it also helps with the assessment of the affective skills. So the Mayor core curriculum and the educational competencies for medical assistants are related very directly. These are something that can be downloaded. As I said, they are right on the website with the standards and policies. And you've got the educational competencies for medical assistants. And you also have the Word document for the Mayor core curriculum. And I'm not seeing any questions in chat, but I'll pause for a moment to see if anyone has any questions that you might want to ask. And I'll keep going then. What I'm going to turn to next, and I'm going to go to another page under the resources tab, and I'm kind of very specifically highlighting the pages that I think you'll find most interesting. This is a page for site visits, and those are accreditation site visits, but this is also the page for the program resources and the program directors. So this particular column here is probably the most useful for my program directors on an everyday and annual basis, as opposed to the information about the site visits. And they use this information all the time. I was just going to highlight a couple of these for you. And one that I was going to highlight, which I'm always amazed at how people use our materials, is the Master Competency Checklist. One of the requirements of accreditation is that the students need to achieve all of the psychomotor skills. And in order to demonstrate that the students have achieved it, the program directors need to keep track of it. What I find the most interesting is we give them this tracking sheet. It's optional use, but what they do is they rework it completely. Rather than the program director owning this master competency sheet, basically the student owns it. So the student is getting checked off on all of the different competencies. And this is another Word document so people can cut and replace, but they're checked off and the student is keeping track of all of that. So the student is in charge of his or her education, and has that ownership in terms of keeping track of this piece of paper, carrying it around to all the different courses, or usually more accurately, it being kept in a folder in a classroom. And they're responsible for ensuring that they have achieved all of these particular skills. I've also seen program directors use this as a curriculum map, so they're able to keep track of what they're teaching, where they're teaching it, and in what order. So it's a great document to be able to adapt, and what makes it so nice is it serves dual functions. You can use it for that tracking, but you can also use it for pedagogical purposes as well. The other item that I was going to highlight is an item that we created mainly, believe it or not, for the site visit, and we ended up finding that people were using it in a completely different way. But this is a checklist for preparing for the lab tour. And yes, it does sound like it's for a site visit. What we found, however, is that people were taking this handout, doing some copying and pasting, and they were using it as a way to teach their students how to inventory. So the students could actually do the inventory of the lab thing, and as well as relating what items would be necessary for what particular skills. So it was an analytical inventory, not just what's here, but also how can it be used and how is it useful and why in certain situations is it necessary. And then the final item, and this is fairly straightforward, is with the syllabus template. And this is something that we publish for people to adapt. And people have found this very useful because it just gives them the bare outline of what needs to be on a syllabus. And then they can just plug and play and use it in a way that works with their institution and their specific roles. So here again, as I said, I really focused on the ones that I thought you would find most interesting. There's a number of different forms in this column in particular, and this is where there's different evaluations, for example, of the practicum site and what students are doing on the practicum, if you're able to put one of those into your program. We also have some templates with technical standards and occupational risks. And that can also be very useful if you're legally required to publish it. It's just a nice template. And I've seen the program directors just kind of use that straightforwardly because they know I contact a lawyer when I put together these documents so that they don't have to contact a lawyer. So that's where they feel very comfortable being able to use that material. So that was my big picture overview in terms of some of the resources that MAERP has available. I can see that Melissa has put the link in there. Basically, the website is maerb.org, so we're very easy to find. I encourage you to come and steal whatever you think might be useful. I'd greatly appreciate if you do so and adapt something, you share it with me because I will make use of that. There is always mutual stealing in education. And in terms of thinking about your needs for resources, I'm always very curious because I develop a new resource at least once a term. Some of them are very specific to one situation, but I'm always trying to figure out how to best help the program directors. And I'd love to know what kind of resources you might find useful because I'm betting it's you're overlapping with the population that I serve. And before you answer on
I was about to say, Sarah, can you see the chat? There's a question there.
I can see the chat.
Oh,
So when you're asking about testing, are you talking about the credentialing or just regular testing for the Mayor core curriculum? And this is where I'm turning to Sabrina.
So Sabrina, you can unmute yourself or you can put that in the chat. Are you talking about um, different credentialing agencies, or are you talking about tests within the the curriculum or the national standards that they use here? I'm looking to see if Sabrina's still with us.
Okay, the
you just,
credential. That is a great question. Basically, for us, in terms of what I do, and this is where I'd refer to my scope of practice, the programs are the ones that deal with the credentialing of students. So for accreditation, we allow for 5 different credentials to count for the outcomes. Programs can determine what credentials they want their students to take. And I see it done in a number of different ways. Some programs say to the students, we want you to be credentialed. Here's a list of tests you can take. Go out and sign up. Other programs say, oh, I am not going to leave this to chance. They sign their students up for the credentialing exam that they use, that they think works best within their communities of interest, because that truly is the central point. And they sign up the students and they escort them in a bus to the credentialing center, the testing center, and the students take the test. So I don't have one answer for that. It's basically it depends where you are, what you do, what your school allows. So some with some of my programs, they actually charge the students the fee in the program fees, so that way the student doesn't have to pay for it out of pocket. And other programs aren't allowed to do that. So, Sabrina, forgive me if I give you one of those it depends answers, but it truly does depend. We don't have a rule about it. We do say to the programs that the students need to be credentialed and we have a threshold that they need to meet, but we give them the option of how they do that.
Sarah, the next question is from one of NCHSE's newest members, St. Bonaventure University in St. Bonaventure, New York. And so there's a question from Monica Thomas. Are you able to see that from
I
Monica?
can see that. And in terms of offering a medical assisting program in a post-secondary institution, generally the process when I work with programs interested in actually I should step back. When I work with institutions interested in starting a medical assisting program, basically they call me and I say, great, that sounds wonderful. Let me take your name. We'll keep in contact. We will send you all of our emails. So, Monica, feel free. And I tell them that the really the first step is to build the program. and build the program according to the Mayor core curriculum and the KHEB standards and guidelines. So follow that. And that, that's the first step. And here, in terms of initial accreditation, we've got an initial accreditation packet. The first step is not getting accreditation. Basically, the first step is building the program, teaching the program, because like most accreditation organizations, we won't even come visit until after the program has been taught in its entirety. So I certainly encourage you to give me a call, and I've written down your name, and I'll find you because I'm pretty good at that. And we can set up a meeting, and I can outline the process and talk to you about the resources where I would be including a few others that I haven't included here because I really wanted to focus more on the generalist here, but I can focus on the accreditation. So thank you.
Wow,
Thank
I love
you.
that win.
Appreciate it.
That's a great win, Monica, right?
Right. I will be in touch.
Okay, wonderful.
Well,
Uh,
if you're not in touch, she's gonna hunt you down. So
Find me, Sarah. Thank you very much. I appreciate it.
I'm pretty good at that. So I know we're running out of time, but I'm going to go back to my question. When you think about the work that you do, is there a resource? And I must admit, I'm talking about paper. I'm talking about, the kind of help and guidance that we all like, that we steal from other teachers. Is there something you dream about having? You can feel free to type in the chat things that would help you with the teaching and learning process in medical assisting. A checklist. That's a great point. I've written a lot of checklists in my life, but people keep calling for them, and those are helpful. But the guide and notes to the NHA, I would probably hand that over to NHA. I will not lie. um, um, but uh, but checklists, thank you. I appreciate that affirmation. I can definitely work on that. And of course, anyone is open to emailing me. So as I said here, I'm available. You can just go to the website, which I probably should have put here, which I forgot. But again, I appreciate Melissa for including it in the notes, so thank you again. And please feel free to contact me because I actually do answer my email and I do respond to phone calls. So I have enjoyed that. I'm looking at um, we've got some other ideas of the checklist um, and creative labs to reinforce learning. That's nice. Okay. That's a really nice idea. So let me bring that to my board because that's an interesting way to do it. And a crosswalk was the NCHSE standards. Nancy and I had an interesting conversation about the connection between our standards and the NCHSE standards. So, huh.
well, we have the template ready for you to do that. And honestly, we could look at your standards and we could do that work as well with the National Health Science Standards. Um,
I will get that template from you because that would also be a fun thing for me to bring to my board. I appreciate that.
okay.
So that would be wonderful. Good. This is where we really like to have affirmation, us administrators. We spend so much time writing in our little offices, you know what I mean? Staring at the window and hoping someone is listening to us. So I appreciate the feedback that you're giving me and the different ideas. That is very helpful. I know you're all tight for time, but I do want to send a genuine thank you with both of my hearts for attending this session, for your contributions. Nancy, as always, your organization has been such a valuable one to connect with, so I appreciate it. Melissa, the icebreakers help, and I appreciate the help with the chat. And for everyone else who was involved, this has been a high spot of my week. So thank you.
We agree, Sarah. Michelle, are you good? Do you need anything else from Sarah before we sign off?
I think we're all good. Thank you to everyone for your participation, and thank you to all who have already signed up for the National Conference interest list. We put the link again. We look forward to serving you all every month, and please let us know if there's any topic you would like for us to include in future educator exchanges. And that's all.
Thank you all so much for coming today. Have a wonderful rest of your day and rest of your week.